Okay.
Why would we need an Omicron-specific vaccine if we're starting to see cases and hospitalizations fall off, and it seems likely that there will be another variant that comes after that?
Yeah, that's a good question. I mean, we're often finding ourselves in these positions where we're working on developing these things, but they don't really arrive at the time that we need them. We've seen them with therapeutics, even with the testing, and now potentially with this Omicron-specific booster. A couple things, each time there's been a new variant, they have worked on specific boosters for that. And we really haven't needed them because the existing shots have provided a lot of benefit. That's good. The numbers may drop off by March or April when this booster may be available, but we've seen evidence of those shots waning in terms of their effectiveness. So could you potentially have some resurgences later on in the spring or early summer? Perhaps. Probably not, but perhaps. So I think that those are two reasons they sort of want to keep this in the back pocket. We don't know even at this point whether the trial will demonstrate that an Omicron-specific booster is of any more benefit yet either. But those are the two main reasons. Might there be a resurgence? Might the vaccines wane in terms of effectiveness?
The U.S. has followed Israel in a lot of ways in terms of how we respond and deal with this virus. Today, Israel's COVID advisory group recommended a fourth vaccine dose for all adults. Do you think that will ultimately happen here? And if you do, how soon?
Well, I think this sort of dovetails on what we were just talking about in part. I think that they do want to see if a fourth shot is necessary. What kind of shot should it be? Should it be a shot of the existing vaccine, or should it be specific? I can tell you we've been following Israel's data pretty carefully. The early data on fourth shots did not paint a very compelling picture to have that across the board. They did have this advisory group which has recommended this fourth shot, but we still got to hear from the Ministry of Health on that. I think it's going to just sort of depend. Can you make the case that the fourth shot is definitively decreasing infections, decreasing symptomatic illness? We know right now people who have the booster, they tend to have pretty good protection against those things as it is.
Let's talk about boosters, because there's this new preprint lab study that shows that Omicron neutralizing antibodies last for at least several months after a booster. This comes on the heels of other studies showing how effective booster shots are. What's your main takeaway from this new study?
Well, I find this really, really interesting. If we can show the data basically looking first at cases and then looking at symptomatic illness. And what they did was they compared unvaccinated, which is the far left, to fully vaccinated, to people who have been boosted. So middle column is 2 shots. The big discrepancy here, Jake, is clearly between the unvaccinated and the vaccinated, period. So we talk about boosters, and you can understand why, because there is an incremental benefit from getting the booster. But really, this is still a story about the unvaccinated versus the vaccinated. But to your specific question, if you look at the time frame now, and you look at, okay, it's been at least 6 months since I've had my shots versus within 6 months, and then add a booster. So if you got your shot 6 months ago, more than 6 months ago, look at your protection, around 57%. That's against hospitalization. Fully vaccinated less than 6 months ago, 81%, so a significant jump there. And then if you add the boost in, it gets to 90%. So what this is basically saying is, yes, the vaccine effectiveness does wane. The booster does make an impact, especially if you've gotten your first shots more than 6 months ago.
So shockingly, average daily deaths have now surpassed the peak of the Delta surge. The U.S. is averaging nearly 2,200 deaths every day because of the virus. How much worse do you think this is going to get before we see that turn around?
Well, I mean, it's tough to think about, but the cases, as we've seen in many parts of the country, have started to decline. It's a little bit of a mixed picture in the United States because you've got different areas of the country that are behaving differently. You can see on the map of the United States sort of where hospitalizations are still going up, and that's obviously a concern in those orange areas. One thing I will say quickly, Jake, if I can show you how Omicron sort of behaves. If someone ends up getting sick from Omicron, there's a lot of people getting infected and a lot of people ending up in the hospital. But overall, the chance of being admitted to the ICU or dying is still lower with Omicron. The reason the numbers are so high is because this is such a contagious virus and so many people are getting infected. So less lethal, but more contagious. That's the problem.
All right, Dr. Sanjay Gupta, thank you.